All right, that particular conversation on cardiovascular emergencies, of course, sets a basis for us for this morning's conversation as we look at the cold weather and cardiovascular diseases. Of course, we'll just be focusing on hypertension, stroke, as well as heart conditions, and of course, not forgetting diabetes. As mentioned during the beginning of the show, of course, I'll be discussing these with Dr. Daniel Nduiga, who is a heart specialist as well as a cardiologist. Dr. It's always a pleasure to have you.
Thank you, Aidah. It's a pleasure to be here again.
All right. Thank you so much. So let us just start by first of all explaining to our audience what exactly cardiovascular diseases are.
Cardiovascular disease is a broad term that speaks about, we call it a constellation of diseases that affect the heart and the blood supply. They're called the arteries and the veins. And these diseases can be at birth, can develop during childhood, but the big pandemic we're having worldwide is in our adults, in the mature and the elderly. So diseases that affect the heart and the blood supply to the body, and especially to the major organs.
All right, so of course these diseases are like hypertension, you're talking of stroke. Maybe also, before we look at now how the cold weather affects this, or how the cold weather, of course, can be a trigger to this, let us just look at the definition of them, just bit by bit: hypertension, stroke, and of course the heart diseases.
So going back to cardiovascular diseases, they can be divided into which category of arteries is actually affected. So that you have the major coronary arteries of the body and the minor. So that you have the major arteries of the body, the ones that come from the heart, go through the whole body. So there would actually have diseases that affect the heart itself, or diseases that affect the blood supply to the body, that is hypertension, or diseases that affect the small blood vessels. So the small blood vessels are the ones that go to the eyes, that go to the brain, that go to the kidney, that go to your legs or peripherally. So you have high blood pressure, which by definition or by consensus is blood pressure that is above the norm for the given society and your given age. Generally, we say blood pressure should not be above 140/90 for anybody. And then you mentioned stroke, which means a sudden cessation in blood supply to a part of the brain. We also have a heart attack, which is also a sudden cessation to blood supply to a part of the heart. Actually, unfortunately, kidney diseases actually fall in there, because when you have a reduction in blood supply to the kidney, or blood supply to the kidney being insufficient, you get kidney diseases, eye diseases, and artery diseases to the legs, so that you find that legs get wounds that don't heal when someone is walking. So the diseases encompass the whole body, actually.
All right, now let us look at now for, first of all, patients with hypertension. How exactly does the cold or the cold weather affect them, for those that have already been diagnosed with hypertension? Yeah.
It's been noted that when it's cold, people get sicker. Actually, we get admissions. And this is actually amplified in the West, where in the West they get a lot of heart attacks, a lot of high blood pressure emergency and admissions during winter. Studies have been done, and a number of them have been what is known as randomized control, which are very good quality studies. Others have been done that are observatory. And for instance, one I could mention was sponsored by the British Heart Foundation, and they did a study in Ireland, in the Netherlands, and in the UK. And they discovered that during winter months, you get higher blood pressures in the population, you get higher cholesterol levels in the population, and you actually get more emergencies in the population just during winter months. So the reasons for this, there's been attempts to elucidate them using good quality studies, but also science gives us some ideas. So you end up having people with high blood pressure having higher blood pressures during the winter months than they do during the summer months.
All right, and how about let us not look at for those that have already been diagnosed, but for someone that hasn't been diagnosed with hypertension, can the cold season be a trigger of the same?
Studies have been done into this, and some of them, of course, you simulate these things in the laboratory. These ones have had mixed results. But the general observation of the population has noticed that people who already have high blood pressure actually present with higher blood pressures during the winter months. A bit of these studies have gone into it, and what has come out as a response or the consensus is our behavior during winter months. Please remember these diseases actually are lifestyle diseases, meaning the way I live. Of course, there's a bit of that has to do with my genetics, with my age, with my gender, with my race. That's important. That I can't change. They're called non-modifiable risk factors for cardiovascular disease.
Yeah.
The modifiable ones actually are the ones that have been pointed out or implicated in worsening of high blood pressure and cardiovascular disease during winter months. Because during winter, people drink more, they smoke more, they take out more, they don't want to cook, they don't want to exercise. Sometimes they can't because it's freezing out there. So you find that cholesterol goes up during the winter months. We find that the high blood pressure is even higher because of taking a lot of coffee. Yeah? We find that they take a lot more alcohol, which damages their heart, damages their blood vessels. We find that they smoke more. So you find that the way we live during the cold seasons is different from the way we live during the summer or the hot seasons. And justifiably. But what the scientists are saying, what the studies are revealing to us is be mindful of your weather during the cold season because you could put yourself in trouble by the way you live.
Does this also apply to stroke and the other heart conditions?
Yes, it does. The winter months are attended by a higher degree of coughs and colds. I remember like a month ago, season where for 2 weeks, almost everybody you met had a bad flu. And the flu had a lot of joint pains, had headache, had chills. And it was actually going across Nairobi to the point that questions were even asked to our authorities, is COVID back? And the answer was, COVID remains in the society, but very, very low level, not notifiable, as in levels that don't require for us to announce them. So you find that during the cold and winter months, there's a lot more upper respiratory tract infections going around. Unfortunately, something called flu also increases during these winter months. And we generally encourage our clients, especially if you're above the age of 65, you have heart disease, high blood pressure or diabetes or asthma, or unfortunately you're undergoing dialysis or you have cancer that you're battling, please get vaccinated, especially before the winter months. We suggest get vaccinated in April, before this rain, then the cold season comes. Get vaccinated for pneumonia and for flu, because these things actually increase. The cold weather increases secretions in our noses, in our throats. We cough a bit more just because of the cold. Allergies increase. Then now the viruses set in and make things worse. The reason I've started there is to say that once somebody has a flu, it affects the whole body, the pressure is bound to rise, for sure, because the body is fighting the infection. The person has fever, he's shivering thoroughly. Yeah, the blood vessels that are on the skin are constricted and they increase the blood flow. There's something known as the fight or flee phenomenon, where the hormones in the body increase just to fight this infection. As a result, there's an impact on the cardiovascular system, and you find blood pressure is higher. The heart has a lot more strain in terms of supplying the body with blood. Strokes can increase. There hasn't been a clear association between strokes and the cold weather, but where the heart is concerned, where the blood pressure is concerned, actually there's a clear association with that.
All right, and just talking of how the heart is trained, of course, during the cold weather, let us just look at the heart attacks and probably the cardiac arrest. Would they also increase during these conditions? And for this case, for those that are yet to be diagnosed with these cardiovascular conditions? Observations that has been done, especially in the West, where the extremes of weather are very, very key, everybody can see, is that people get sicker during this season, be it high blood pressure, be it heart attacks, be it heart failure. People actually attend hospitals more. Usually, this rides on a flu pandemic. So a person has flu and heart failure, flu and heart attack. You get severity of the coughing and the sneezing and the wheezing, and the heart comes in attendance because it's one body anyway. So that has been noted. It's also been found by science that during the cold weather, you find that it's easier to lose heat, which puts somebody in what is known as hypothermia. Hypothermia puts a lot of strain on the heart to supply enough blood to heat the body up. That's an issue because it can lead to heart failure. We find that the physical work during cold weather, especially in the places that are extreme, or in some of our highland areas that you actually get snow, or temperatures go all the way to about 10 degrees. As you're doing physical work, you're losing more heat, and your blood pressure is rising just by doing that. So you actually have to take breaks in between, so that you don't, what was A doesn't go to B in terms of severity. So you find that the weather has an impact. It's not 100% that with cold weather you're going to get sicker. It just that means with cold weather, take more precautions, be a bit more careful, be faithful to your medication, don't indulge. See if you can find a way to still keep doing the same exercise, because it helps control your blood pressure. Yeah. All right, and just talking of blood pressure, of course, I'm sure there is a linkage of blood pressure and blood sugar.
Yes.
Would you say the cold weather will also affect patients with diabetes as well?
Left to science, because the heart rate increases, the metabolism increases, sugar should actually go down in cold weather.
Okay.
Having said that, it's a very stressful situation. In stressful situations, you get the stress hormones coming up, which raise the sugar. So it's a two-edged sword there. Then on top of that, we have human behavior, what you and I are going to do in response to the cold weather.
Okay.
We'll ask for a cake. Yeah, we'll take lots of sugar in our coffee, which raises the blood sugar. So this is a mixed bag where the cold weather and diabetes is concerned, but the human factor is what actually will shift us, whether we go towards the positive or the negative. Having said that, if we do experience extremes of weather, our sugar is likely to rise and become uncontrolled, because that's the body's stress response. So if you have a chronic illness, high blood pressure, diabetes, you're fighting kidney disease or any other illness including asthma, please be extra careful during these cold months. Don't change your lifestyle. Don't buy a whole packet of cigarettes that you want to finish by 10 o'clock. Do not buy several bottles of liquor and those ones you're going to finish this week. Please live your life moderately. And if you can stop some of this that we call harmful leisure activities, please do for your own sake.
All right, and you've mentioned flu among just other triggers, of course, of these cardiovascular diseases. Will they, especially during this cold season, are there any other signs that probably these diseases can present themselves in for you to know that probably I will be suffering at any point with a cardiovascular disease?
So once again, we've said if you do have the illness already diagnosed, if you're above the age of 40, if your body mass index, remember you spoke about body mass index last time, which is your weight divided by the square of your height, body mass index is above 25. If you've been found to have a waistline that's above, is it 38 or 39 for men, about 34 for women, if any of these things apply to you, if there's a strong family history of blood pressure or diabetes, please take an extra step to protect yourself during this season. If at any point your pressure has been found to be high or sugar has been found to be high, take measures to protect yourself during this time. Don't change your lifestyle too much. Try and maintain the healthy lifestyle that you're already living in before. If you are known to have these diseases, please be faithful to your medication. Don't change your diet too much. Try and be as active as you possibly can, and don't expose yourself to baridi, to the cold weather, if you can. And if you do, make it short periods of time, then come back. Because cold weather on its own puts a strain on the heart and the blood vessels.
All right, and that is quite a parting shot, I'll say, but still, I'll still give you an opportunity just talk to the audience, generally, not necessarily about the cold weather and cardiovascular diseases, but just generally about prevention and, of course, management of cardiovascular diseases.
Thank you so much for having me in this place, Aidah. I'm very grateful. I'd just like to speak to our audience and to encourage you that, especially if you are above the age of 40, if you have been diagnosed with high blood pressure or sugar, during this cold season, please take care of yourself. If you do take medication, please be faithful to that medication. And if you have to stay indoors, because many of our jobs these days are actually at home, we actually work from home, we don't have to go to work. Don't try and finish a whole crate of beer or whiskey. Don't finish 3 packets of cigarettes that particular day. Please take care of yourself. Don't take so much coffee and so much tea that it's much more than you used to. Because it's been found that it's our lifestyle and our habits during these cold seasons that put us at higher risk of developing more cardiovascular disease. If you've been found to have these illnesses, please come in, let's have a look at you. If you've not been found to have these illnesses, yet you fall in the high risk category in terms of your age, in terms of your weight, in terms of your family history, please come in, let's have a check on you. And as I mentioned earlier, we would actually strongly encourage anybody above the age of 65, anybody who has high blood pressure or sugar problems or asthma or battling any chronic illness to get vaccinated around the months of April. I know we are a bit late now for this year because the cold is already with us, but we suggest that next year by around April, please get vaccinated. Sometimes we encourage our clients to also get vaccinated around September because you have 2 flu seasons in our country. That is the one around April going all the way to July, another one from September. It follows our rains, the long rains and the short rains. So health is actually within your hands, within your grasp. A lot of it depends upon your habits. A lot depends upon your decisions to take care of yourself. Yes, there are things that you can't change. I can't change the fact that I'm a young black man. Youth ends at 40, so I'm beyond the youth part. But there are some things I can change. I can change whether or not I exercise, whether or not I overeat, what my weight is, whether I take alcohol or smoke, and I can change whether or not I use a lot of salt in my food. And taking all this into consideration, we'll be able to bear this cold weather, we'll be able to come through the other side healthy and strong.
All right, thank you so much, Daktari. And of course, as I had said earlier on, it's always a pleasure to have you on set, and always a pleasure, of course, just to hear you inform our audience as far as, let me say, heart conditions are concerned.
Thank you so much, Aidah.
All right, so that's where we end Kirk in the morning today. Of course, just borrowing words of Daktari, your health is actually in your hands. Of course, as he puts it, it's all about behavioral factors, or exactly how you live your life, or just your lifestyle. So thank you so much for tuning in. That was Dr. Daniel Nduiga, who is a heart specialist as well as a cardiologist, just trying to explain to us how exactly the cold season can affect, or the cold season and cardiovascular diseases. We have looked at stroke, hypertension, heart diseases, as well as diabetes. Once again, thank you so much for tuning in. I'm wishing you a beautiful Monday. See you again next Monday. As always, your health matters. My name is Aidah Munzatsi.